Okay, so now we're going to talk about the 3 stages of adolescent development. Um, so there are 3 stages of adolescence: early, middle, and late. So early adolescence begins about 11 to 13. Middle adolescence is 14 to 18, and late adolescence is actually 19 to 21. So even though someone's graduated from high school, they still haven't quite reached adulthood in terms of healthcare, in terms of their health. Okay, so and most of that has to do because of their brain development. So making sure we understand that. So the 3 areas of development, we have physical, cognitive, and social emotional. So the cognitive piece is the most important. So the brain continues to develop into late adolescence. So that executive functioning, the ability to reason, control impulses, and weigh long-term consequences, it doesn't actually fully mature until around age 21. And of course, remember, there's plus or minus on this, so it could be about age 22, 23. So something that's really important to understand is when you have younger people who are in the workforce with you, 21, 22, they're still reaching that high executive functioning. And that's something to consider when we talk about the graduation age and people entering the career field, and then, of course, the level of maturity that we're seeing with each new generation. So we talked a little about this earlier with the multiple levels of influences on adolescent behavior. You have the intrapersonal, interpersonal, institutional, community, and society. So the intrapersonal are the individual attitudes, beliefs, knowledge, and developmental influences. So at this point, these things have happened to develop someone's intrapersonal system, and that's going to be the most influential. However, the next influential piece to them is their interpersonal connection. And so family, peers, and romantic relationships. As people get older, the intrapersonal and then also outside responsibilities become important in a more even way. But with adolescence, you see that this intrapersonal and interpersonal connection is actually quite strong and large and overwhelming. Of course, there's institutional. So influences from school, healthcare institutions, so, understanding about what's good for their health, the CDC, the WHO. Community level influences, and then society and policy. So we've talked about the family talking together and how it improved unwanted pregnancies and STIs and just the changes in drug use. So that's really helpful. All right, so now we're going to talk about graduated driver licensing system. So one of the high causes of death in adolescence is MVAs, obviously. So now there are learner's permits, provisional license, and regular driver's license. Some states have a higher driving age, like California is still 18. And so all states have the GDL laws with 3 graduated stages. Once you're over 18, you can skip those and go to regular driver's license. I think you have to have a short learner's permit period. What's interesting is there's some additional restrictions that vary by state. So it requires parent or licensed adult to supervise adolescents to drive during high-risk hours, so early morning and late at night. There's nighttime curfews for driving, and then restrictions on numbers and ages of passengers. So this came into play in the last 10 years. And they have seen in the states that restrict the ages and numbers of passengers with drivers, deaths and accidents going down. And part of it is just a distraction issue. Remember we talked about that executive level of cognitive functioning, and your impulse control is a lot lower when you're younger, and then you have other people influencing you in the car. So driving fast, running lights, running railroads, and then of course maybe making bad decisions with texting and driving, and being on the phone and driving. So fatal crashes among drivers 16 to 17-year-olds were compared to fatal crashes among 19 to 20 and 21 to 25. And obviously there was less fatal accidents as the age group got higher. GDL laws were rated, and those with 5 of 7 additional restrictions were defined as good. And then, of course, we have the zero tolerance alcohol laws that were assessed. And so any amount of alcohol in their system, it accounts for a DUI. It actually, legal limit, it still used to be what was considered a DUI under the age of 21, and they changed that. So the GDL laws actually led to fewer fatal crashes, as we talked about that. It reduced fatal crashes among 16 and 17-year-olds by 7 to 14%, depending on age group. And then states with good GDL laws have fewer fatal crashes. States with good GDL laws and zero tolerance alcohol had the fewest fatal crashes and additional restrictions. So they found that additional restrictions are important. Now, some GDL states with higher restrictions even have restrictions driving to work and back outside of school hours, and you require a note. So it just depends on where you live. I'd love to hear about the GDL and extra restrictions that you know about where you guys live. So using multiple interventions to reach adolescence, talking about how the healthy choice is the easy choice, and also utilizing the influence that goes into an adolescent's decision making. So knowing that intrapersonal and interpersonal is going to have way more influence in society and policy. So schools is a venue for promoting health and wellness. Okay, so why schools? Schools are an ideal place because most adolescents still attend school. We do have a pretty high dropout rate in the United States, but still that's a really easy way to capture them. So you can connect with most adolescents. We can teach them about their health, and healthier students are better learners, and there's tons of studies that support the healthier somebody is, the better chance of them getting properly educated, which is why people fight so hard for young children to at least have access to health care. Okay, how can schools impact adolescent health? So we create a healthy environment. So non-smoking schools, right? Violence-free schools. Violence and health go hand in hand. So schools that have zero tolerance for bullying, for violence, for weapons, for drug use, for tobacco use are going to have a healthier environment than those that have policies that they recurrently ignore. And some of you might think like, oh my gosh, what school says they have zero policy but still allow guns? And it's not necessarily that they allow guns, it's that they don't reinforce the policy for whatever reason. And I can't answer as to why that would happen, but it does happen, and those schools aren't as healthy. Teaching health education and physical education. Now, I don't know about you guys, but when I was in school, this was just part of my curriculum. It was never a problem. We had health teachers, we had PE teachers, they were separate. We also had separate times for further health education when the need arose. So when it was time to talk about puberty, time to talk about sex ed, time to talk about when gun violence started coming into play after Columbine and bullying, there was always time and money to have these conversations. But I grew up in I went to a private school, so we were lucky to have those resources. I also grew up in a public school system where they also had those resources. I now work in a urban public school system that doesn't have those resources, that health education and physical education has now come back with grants. And many of you might be able to attest of knowing of schools that don't even have recess anymore, let alone PE, or could pay a health teacher, and a certified health teacher at that. And then providing health services. So that kind of fell out on the wayside for a little bit. I know that by the time I got to high school, a school nurse, we just didn't have one. But when I was in grade school, we had a school nurse who taught health and also did a lot of preventative services. Now many of the schools, they have school nurses, school nurse practitioners, health clinics for the students and the families. And that is also going to impact adolescent health. They offer birth control, prenatal care, prevention for STI, STD, abuse, mental health, and they're all in the school system. And that's actually been shown to be effective in promoting a healthy school environment inside and outside of the school.